So if you're at the stage of considering knee replacement surgery, it's important to remember there are two options. There is a standard total knee replacement and also the very good option of partial knee replacement, provided you are suitable for it. There are a number of benefits to partial knee replacement over a total knee replacement. It is a smaller operation with a quicker recovery. People tend to have better function following partial knee replacement surgery. This includes a better range of movement. They tend to walk with a longer stride length and find ascending and descending stairs more easy. In addition, there are reduced complications and the long-term outcomes are extremely good. Probably the main potential risk following knee replacement is stiffness. As a result of this, exercise and physiotherapy is very important to achieve a good long-term outcome. I actually encourage most of my patients to start their physiotherapy or exercises prior to their operation. Something as simple as acquiring a static cycle can really help improve range of movement and maintain muscle tone and flexibility, which will help them with their recovery in the long term. Well, every joint replacement in the United Kingdom is entered into a national joint registry and has been for the last 20 years. And as a result of this, what we can say is how long knee replacements last at a specified amount of time. For instance, at 10 years, 97% of total knee replacements are still working well. At 10 years, about 94% of partial knee replacements. So there's a 2 or 3 percentage points difference between the two. At 20 years, there's still almost 90% of knee replacements working well, and therefore we can safely say that the majority of knee replacements will last 20, 30 years plus, and for most people, it'll be a one-off operation.